I will start. Good morning. We are continuing the same package where we started yesterday and says Dilantin on the first page, and I'm on page number 24, and I'm going to talk about anemia. And we already finished arterial and venous circulation, and with venous circulation and the answers is very important to know because it affects the circulation. Now, anemia is reduction of hemoglobin. Now we all know what anemia can cause to our patients are. So we must know normal level of hemoglobin, normal level of hematocrit, and once your patient are low and hemoglobin is called for erythrocytes, your red blood cells are low. And what does anemia leads to? We have few symptoms here: palpitation, dyspnea, diaphoresis, fatigue, and cold. Very important. But what does anemia can cause to our patients? And a lot of question can be to prevent them from fall, because they are having what? Lack of oxygen. Hemoglobin carries your oxygen. So remember, the word is called dizziness. So what they are? Because they are not getting enough oxygenation. So your patient, now you do have dyspnea, fatigue, but dizziness makes them to fall. So their risk for fall. Everyone remember in our question, we are nurses, and what do you tell them? Colite, CNA to ambulate and prevent them from fall. Yes, they feel fatigue, that's important. Cold is good. Dyspnea, and also remember the word is lack of oxygen, and hypoxia word. Anemia, identify the cause. There are different kinds of anemia, and rest is important. Diet is very important, that you give them high protein, high iron diet, and high vitamin diet. So we all should know iron food. What food do you give? What food do you increase in protein? And protect them from infection. So anemic patients also, their risk for infection. So we can add their risk for infection. And remember, so you're going to protect them from infection and protect them from fall. So that is important for anemia. Now I'm going to go, there are kinds of anemia. So one is iron deficiency anemia. What do we do on iron deficiency anemia? Page 12, we are talking on page 12. Iron deficiency anemia, very important. We all know tiredness, that's good. We all know they're dizzy because that's a deficiency of iron. But let's underline the word glossitis and write down the word chiliosis. Sometimes they use the word chiliosis. C-H-E-I-L-O-S-I-S, chiliosis. And chiliosis and glossitis, mouth infection and lip. So they have lip infection and their gum. So there is a glossitis word, chiliolitis word, and mouth ulcer. So write down the word, they get mouth ulcer. And that is, and their fingernail, those are two answers are important here. The fingernail shape, they changes more like spoon. And also, whenever you are anemic, you're dizzy as well as impaired cognition. What is the meaning cognition? Your thinking process, more like confusion. So anemic patients, they cannot impair thinking process. Your cognitive word is for your mind. What do you do when your patient has iron deficiency anemia? Why they are having iron deficiency? Because they're not eating enough iron, maybe. And so how do you treat them iron deficiency anemia? First thing is, remember your diet. So what diet are you going to give them? Liver. Green leafy vegetables are very good. So remember, iron, green leafy vegetable. And also, I want you to write down, egg yolk is good. And iron fortified cereals are good. Raisins are good. So green leafy vegetable, anything green leafy vegetable comes, you pick up, because a lot of time food, they're looking like more vegetarian patients or they can't eat the meat. So next thing is, you're going to go liver, you can add there raisins. Raisins are very good for your iron. So I want everyone, and especially the kids, Remember, in Pete's question, do not give milk a lot after 1 year of age more. Why? Because they get iron deficiency anemia. So now your whole milk is not good, cow's milk is not. So more iron fortified things you should give it to the child. So that goes in anemia. Now the next thing is we talk about pernicious anemia. We all know what is pernicious anemia. Remember, pernicious anemia comes from when you have deficiency of what? B12, and I want you guys to add their intrinsic factor. Now, intrinsic factor is missing in the stomach. And when intrinsic factor? So, sometimes the questions are, how does you get the anemia? Intrinsic factor. Where is intrinsic factor is in the stomach. So add there the word intrinsic factor is in the stomach. And when do you have a problem after surgery of GI? And write down Bilroth 1 and Bilroth 2 are the one after surgery patient has deficiency of B12. Are we clear? And I said also yesterday, the patient, what test do you do to diagnose B12 deficiency is called Sling Test. And what do you collect in Sling Test? The urine specimen. How do you collect it? 24 hours urine, and make sure they give B12 radioactive by mouth, and then it excreted out in the urine. And also B12 deficiency, it says red tongue, but I want you to add their beefy red tongue. So beefy red tongue goes in your pernicious anemia. Paresthesia, those are two very important. Paresthesia means tingling sensation of deficiency of B12. How do you treat them? You got to give them B12 injection because it doesn't absorb through the stomach, so you have to give injection and rest of life. And how do you give B12? IM, it says there, you can go deep IM and give B12 injection. Now sickle cell anemia is another anemia. And what is sickle cell anemia? Is sickling of the cell, and hemoglobin changes with a different hemoglobin. So remember, clumping of the cell. So write down the word clumping. In your question, when they give sickle cell, they're going to use the word clumping of the cell. So whenever you have clumping word, they become clump, they change the size of the cells, and it lead to anemia. But very important is when they're going to give you a question, they're going to use the word sickle cell crisis. So I want you to write down the word sickle cell crisis. And what happened in sickle cell crisis, you got to monitor patient for two things in sickle cell crisis. Number one, I want you, if they ask you what do you monitor when the child or patient has a sickle cell crisis, number one, pain. And where is the pain? Is number one, is all over in the joints. They have joints pain and abdominal pain. I want you to write down, why do they have abdominal pain? Because the spleen enlargement. So there is a spleen enlargement. So write down the word spleen enlargement, and it's called sequestration. So sometime in your question, they're saying, child has sequestration crisis, means enlargement of the liver. Are we clear? Not liver, is the enlargement of the spleen. So make sure we all know that there is an enlargement of the spleen, and sequestration crisis is they're in a pain and the spleen is enlarged and it can rupture. So remember, avoid palpation, avoid pressure here. Number two symptom is a fever. I like it to keep in an order because your questions are based on like this. Now even I'm going through here, but I want you to write down. Now they do have, it can go, all anemia can go to jaundice, murmur, tachycardia. But very important word is clumping of the cell. It's anemia, and it's very common in the black children's. And is also pain and fever, very high fever. So if they're going in a crisis, what do you monitor for? Fever and pain. And then I want you to write down in treatment, HHOP word. is hydration. Very important in treatment and crisis, you give them fluid. So write down the word hydration. So hydration means you are giving fluids, PO, IV, and a lot of, because they're children, in many questions they will throw the word increased popsicle because it's a fluid. So you pay attention, what are they asking? You are increasing fluid. So to cut down this crisis, what are you going to give them? Fluid. So what is important? Fluid. Second thing, to apply heat, maybe warm pad on the joints. So all the joints are very painful. You can apply the heat on the joints. Oxygen. Now you give oxygen is one thing because they're lacking oxygen. So why are they going in a crisis? Because of hydration, because of oxygen. So what do you do here? You give them more oxygen. Maybe in your question, check the capillary refill. Maybe check pulse oximetry. Maybe positioning, semi-fowlers. See, the questions are not straight in all the time to give them this and give them that. Are we clear? So your questions are, you got to improve oxygenation and rest. Why? Because you cut down the activities. If you work more, you need to have more oxygen. See, your questions are so differently worded because they're just looking, can you apply your critical thinking? So as a nurse, not only give oxygen, maybe your answer is raised ahead of the bed semi-fowlers. Give a bed rest. What are you cutting down activities? Check the capillary refill. Give them oxygen. So that is, you're giving oxygen, but also remember these answers. Pain medication, they're in pain. And what pain medication you're going to give them is called Demerol. So make sure you're giving no Demerol here and any other pain medication. So always remember, you do not give Demerol for your sickle cell babies. Don't give Demerol for sickle cells baby. We are on page 24. And that is the package with dilantin. So those who are just coming in, just continue watching on that. And it's on page number 24. Are we clear? And we are talking about anemia. So, and I'm talking about sickle cell anemia. So I want everyone, we all know sickle cell anemia comes from where? Clumping of the blood, and it's a genetic problem. And what do you treat them? How do you treat them? So some questions are going to be hydration answer, some may be question oxygen, some may be heat. Everyone remember, do not give Demerol. Who do you give Demerol? Which patient do you give Demerol? When you have pain in pancreatitis and cholecystitis in GI system. No morphine there, you give Demerol. And remember, no Demerol in sickle cells anemia. The babies, they can get seizure, so they don't use Demerol. Any other pain medication they can give. But yes, they do need on pain medication. Remember, they have pain in the joints. Your questions are going to be, now this is the way you remember, and also positioning. And if you do Saunders question, they have questions on that, positioning. Remember, do not raise the knee gauge. What is a knee gauge? When you're raising the foot of the bed, the patient leg is going to bend, and that is called knee gauge. Now, what happens when you raise the foot of the bed? The knee are going to be bending, and does it cause pain? Yes. And same thing, your positioning, no more than semi-fowlers for oxygenation and pain. If you let them sit in a fowlers, the pressure is going to be on the knee. So remember, on your positioning, very important. The questions are related to the problem, but nursing intervention, we got to know you have to keep your patient comfortable. Position would be good here, semi-fowlers, because of the pain. You can use the heating pad or warm compress, pain medication, and do not knee gauge and no more than semi-fowlers position. Are we clear? So that may be covering our sickle cell anemia. So let me go on the sickle cell. They have pain, swelling, fever, jaundice, cardiac murmur. Whenever you are anemic, your heart is going to have murmur. And whenever you are anemic, it may lead to tachycardia. Now, I want you guys to go on the intervention. Check for sign of infection. Check joint area for pain and swelling. Fluids is important, and analgesic, they can use the PCA pump so patient can regulate themselves. Now, I will go on in anemia, and I want you guys to add 2 more types of anemia. Now, we all know iron deficiency anemia. Iron deficiency anemia is also common in the children, but I'm going to go Cooley's anemia. I want you guys add there. Ever in your question come, you must know Cooley's anemia or thalassemia. So Cooley's, Cooley's anemia, and other name is called thalassemia, 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 and these are both kinds of anemia. And what is these anemias are is when the child's patient is, anybody is born, this anemia, red blood cell destroy premature. That means they are not getting matured, so it leads to anemia. So I want you guys to write down there, red blood cell destroy premature. As soon as the RBCs are coming up, they are destroyed. Are we clear? So what is your red blood cell? Leads to anemia. So what is it? I will write down here. RBC cells are destroyed. They're destroying premature. So it's your system. It doesn't let them grow, and so it leads to anemia. So remember one word, what are destroying prematurely? Your red blood cell. So how do they treat them? So they become anemic, and so they have to give iron or blood transfusion. So they can give them iron or frequent blood transfusion because they are anemic, and it's called thalassemia anemia and Cooley's anemia. But one thing comes in exam. Now, because you keep on giving iron and blood, they are overload with iron. So they have toxicity of iron. And they ask you, what drug do they use to remove chelation of iron? How do you remove that thing? Is desfroxamine, Defroxamine. Defroxamine is antidote, and this comes in exam. What is the antidote? So when I'm moving on antidote, I'll talk again, but I wanted to know this medication is used to to remove the toxicity of iron. So what is the antidote for iron? Is called desfroxamine, Defroxamine. Another name for this is also Desferal. Froxamine and Frazzle, remember the one iron. Ferrous sulfate, iron. So it's more as defroxamine and desferal. That is a antidote for iron. Everyone is okay. So what happened? You keep on giving too much of iron and blood transfusion, you're building up more iron, and it leads to what? Cooley's anemia. But the problem with them is they can have toxicity of iron. So what they have to do, they have to antidote used to remove extra iron. So what is Cooley's anemia has nothing to do with the diet. Are we clear? What it has to do is your body is not building up the red blood cells. So they got to treat them with medication. I want you to write down another anemia. So we got to know anemia wording. If ever question come, you should be very clear what kind of anemia patient has. I will write down the next word, polycythemia. Polycythemia. Polycythemia Vera. That's another anemia. Polycythemia. Polycythemia Vera. What is polycythemia vera? Is poly means more. The red blood cells are very high, and it leads to the number of hemoglobin. So what happened in their body? Number of, you can write down, number of hemoglobin, which is Hg, 18 gram per dl. So they go very high. What does it go high? Their hemoglobin. And red blood cells go, so you got to remember, is polycythemia means is your number of red blood cell, hemoglobin, they increases. So hemoglobin goes about 18 gram per DL, and red blood cells are increasing to 6 million per ml. Then also your hematocrit is increasing 55%. And I'll tell you, everyone, you must know your normal hemoglobin because of iron and anemia, and a lot of question on hematocrit. So what happened here is Polycythemia Vera means number of hemoglobin. So your red blood cell, hemoglobin, red blood cell, hematocrit, they go more than your normal. So it's called Polycythemia Vera. So what happened? Your blood is very thick and lot of hemoglobin, red blood cells, and hematocrit is there. So how do they treat them? So question, they might give you, your patient is admitted with Polycythemia Vera, how do you treat them? Number one, you got to, because they're very concentrated, so you give them fluid. So write down the word treatment is hydration. And number two is hydroxygel. Hydro, H-Y-D-R, hydro, and is hydroxy area, hydroxy area. So this is the drug, but then main thing is hydration, and then you will go phlebotomy, P-H-L-E-B-O-T-O-M. What is phlebotomy? Removing the blood. That is important. So they have to go frequently. You're removing the blood. So this one is H-Y-D-O-X-E-A, hydroxia. So, and phlebotomy. So hydration and phlebotomy is the treatment. Are we clear? So many questions I came across, and they had the question on patient is admitted with Polycythemia Vera. What do you as a nurse increase? Fluid. You got to remember. As a nurse, what is another treatment they're going to do it? They're removing the blood because they have a lot of concentration of polycythemia. So we must know iron deficiency anemia and pernicious anemia, sickle cell anemia. We talked about Cooley's anemia and Polycythemia Vera. I want to go on aplastic anemia. What is aplastic anemia? That's a different one. Aplastic anemia is, and which patient goes in your reverse isolation? This one. Why? Not because of anemia. Why do you put aplastic patients as anemia? Because the bone marrow destruction. So what happened? The bone marrow destruction. Bone marrow destruction. Everyone is okay. So what is it destroying here? Bone marrow destruction. So what is bone marrow? Your red blood cell. And how do you get destruction? Maybe some chemicals, some drugs can. So everyone reason could be some chemicals you came across. Maybe some drugs can also cause. In some of the question, chemicals can destroy your red blood cell, yeah. And also bone marrow destruction. So what happened? They're low red blood cell, and they have low white blood cell, and they have low hemoglobin. Are we clear? Because that is it, producing red blood cell, white blood cell, and low platelet count. So not only aplastic anemia is risk for infection, they have low red blood cell, and they're also risk for bleeding. Are we clear? So everyone should know aplastic anemia. I want you guys to add one more thing go back in a sickle cell anemia. Now, a lot of child with the sickle cell anemia, I said, is affecting the spleen. We did sequestration. They also, sickle cell babies can lead to aplastic anemia. So write down, aplastic means is you prevent them from infection. Some question, they don't use the word aplastic, but they say sickle cell babies, what is your priority to prevent them from infection? So aplastic anemia is separate, but I want you to go back and add also in sickle cell. Everyone should know in sickle cell babies, the spleen is affected and bone marrow is affected. Are we clear? So what is your priority for the babies are here is prevent them. In your simple question, you are a nurse, what are you preventing them from? Infection, aplastic anemia. What are you going to increase? Fluid. What are you going to give them? Oxygen. What are you going to give? Positioning. So remember, your questions are based on what really patient is going through. So that is called aplastic anemia. So everyone, you guys got all anemia. Everyone remember the word anemia can lead to your patient was risk to fall. Why? Because they're not getting oxygenation. They're very dizzy. They're weak. So you got to prevent them. All our questions based in Nclex are prevention from fall and safety. So you got to teach CNA, you got to tell the patient. Next is hemophilia. Now what is hemophilia word is here is the bleeding disorder. And what is in the bleeding disorder is, now it says in the treatment factor 8. You give factor 8 in the second box. So write down the hemophilia is deficiency of factor 8 and factor 9. Clotting factor. And that is why your patient is bleeding. As soon as you see your question, you remember the answers are prevent them from bleeding. Are we clear? So now let's go in the first box, and it says bruising. So what are you going to monitor when your patient has hemophilia? You monitor for bruising, ecchymosis word, and it says joint pain. I want you to write down the word. In the lot of questions, they will say it can cause hemoarthrosis. What is hemoarthrosis? The bleeding in the joint. So write down where it says joint pain and monitor many book. You have one answer only. The child is admitted, the patient is admitted with hemophilia. What are you assessing? An answer is hemoarthrosis. Hemo means bleeding, arthrosis is around the joint area. And anywhere bruising word comes. And what would you be, the reason is they're missing the clotting factor. That's important. And also prolonged bleeding time. So what do you do for your patient here? The treatment is give factor 8. That is number one answer. Give them pain medication and also cryoprecipitate anti-hemophilic factor. So cryoprecipitate, you can give them hemophilic factor, but number one is you give them factor 8. And also lifestyle, teach them to prevent them from bleeding. Constipation, injection, because they are risk for bleeding. Constipation, why? If you're constipated, you can bleed rectally. Giving injection, apply the pressure because you don't want to bleed. So you go that, and no contact sport. So remember, if the child is there and the adult, when you're using knee pads and helmet, and always remember, any patient who's risk for bleeding, they might give monitor level of consciousness. Why? They can bleed in the brain. Write down the word stroke. Cerebral hemorrhage. Not only hemorrhage in the body, it can bleed anywhere because it's a tendency to bleed. And I came across wherever you have bleeding question, they have given a stroke. They have given level of consciousness because they're not bleeding over here. Your brain blood vessels can rupture and you can bleed. Now, so we did hemophilia. I'm going to go in cancer, and I want you guys add a little bit in your notes. First thing I want you to add underneath or in the corner, and you must know, cancer is very important for your Nclex. As you're coming across any question, you come across, make sure you read carefully, because I want you, what is the reason for cancer? Why does the people have cancer? And the etiology, you can say, or the reason for cancer. How do we get cancer? Number one, your chemicals can lead to. So I want you to write down, is the reason for cancers are chemical. So if they're saying in your teaching, you're teaching people who are the risk for cancer, is number one, chemicals. And what is chemicals means? Your drugs. Maybe you're smoking. A lot of cancer comes from smoking. Your bladder cancer comes from smoking. Your lung cancer comes from smoking. Laryngeal cancer comes from smoking. So I want everyone, you know your reasons for cancer. Number two is tobacco, any chemical drugs, and physical carcinogen. What is your physical carcinogen? Number two, you're coming in X-ray. You go repeatedly X-ray. Ultraviolet rays can lead to cancer. Sun, any tissue trauma can lead to cancer. So any repeatedly radioactive ultraviolet rays, X-ray can cause, and tissue, any tissue is getting exposed and trauma, they can lead to cancer. Sun will lead to get from sun what cancer? Your skin cancer is common with the sun. Next is very important, the reason is your viral. You do have viral cancer. And what is the viral R is called oncovirus. I will write down O-N-C-O, covivirus, oncovirus. Wherever you see could lead to cancer. Epstein-Barr virus. Epstein-Barr virus. So, in your question, does virus cause cancer? Yes. Or Epstein-Barr virus. Hepatitis B virus can lead to hepatitis B cancer. Very important, HPV virus, human papilloma and which one this cause cancer is cervical cancer. Comes in exam and they ask you cervical cancer caused by what? HPV virus. Are we clear? And very important, you cannot teach unless you know how do you get the cancer. So your teaching questions are, and what are the reason could be to get cancer? We said chemical, physical, like X-ray, radiation, sunlight, ultraviolet rays, virals, oncovirus virus, Epstein-Barr virus, hepatitis B virus, HPV virus can lead to what? Cancer. So you should know that. And number 4 is your diet. So now next is, I want you to write down the one diet. What diet is causing cancer? Is number 1, your cholesterol. If you're eating a lot of cholesterol is not bad only for your heart, but you lead to cancer. So your diet, if you're eating high in cholesterol and you're not eating less fiber, your risk for cancer. So increasing fiber in diet is good for your cancer. And what do you decrease in your question for your patient is cholesterol. Are we clear? And cancer, next reason, age. As you're getting older, your risk of cancer is higher. I want you to add there. So risk for cancer is getting higher as we are getting older. Who you're going to teach the breast examining? Older people, not the younger one are risk as you're getting older. So if they ask you which people are you going to give teaching to prevent cancer, older population. Are we clear? So everyone should know is a diet. In diet, I'm going to add more thing here. Any preservatives. That is why people are going in what? More organic food. If you stored longer and you use preservative, all that frozen and the other food, anything in the diet, the word is nitrate, can lead to cancer. Fat animal fat, meat, especially your red meat. And also any additive word, A-D-D-I, additives. And very good, increasing in diet, cut down cholesterol, increase fiber, and vitamin A and vitamin C is very good to take it to prevent cancer. And also the vegetable, flower vegetable, and we use the word cruciferous vegetable, cruciferous, the word, and the meaning cruciferous vegetable are your flower vegetable, like cauliflower, broccoli, Brussels sprout, those are good. The flower vegetable are very good for your cancer. See, your questions are a lot of educational and teaching. Breast examination, you all should know in cancer. Testicular exam, we all should know. But very important in your diet. What do you avoid in diet? Any preservative word, nitrates word. fat word, an additive word. And what do you add in the diet? Vitamin A, C, and flower vegetable, and decrease cholesterol and increase fiber. To be clear, I wanted that, and I added in my notes because when I do cancer, I cover 8 hours. But for now, at least you must know cancer because it's very lot of patients with the cancer we are dealing. So questions are going to be preventively. How do you get it? How do you prevent? I added. Now I'm going to go back on your box on this page at the last thing, cancer implementation. How do you treat them? Is leave marking in external. So how do you treat them? External radiation. In external means patient is getting radiation to the point. And what do they have? Marking. And those marking, don't wash them, leave them. Avoid using any cream on the skin and lotion, and only A and D maybe they can use. So no cream. And why? Because their skin is very sore. Are we clear? Washing with the skin. Now next page, if you move on 25, is check for redness, check for cracking. Cotton clothes are good. Antiemetic for vomiting, because they feel nausea and vomiting, antiemetic is good. And I want you to add there the word, when you're cleaning the skin, avoid using harsh soap, and maybe without soap is good, and use the word is not rubbing but patting. Patting means you move from one hand to other. So don't rub them, but how do you clean? They use the word patting. You move, because your rubbing is going to cause more irritation to the skin. So add there, when you're washing, you do not rub it, but what do you go? The word patting. And also don't apply any cream unless the doctor has ordered. Restrict the patient going out in the sun because they get more irritated. So in your teaching, external is more your skin care. Everyone is okay. Internal radiation, when they are saying cancer implementation, internal radiation, sealed source. I want you to add one word, and they throw in the exam and in the question. And when we are using the radiation, they don't use the word radiation, but they use the word brachytherapy. Write down the word brachytherapy. B-R-A-C-H-Y, brachytherapy. Whenever you see the question brachytherapy means radiation source. So what are you giving here? Radiation. How do you give radiation in brachytherapy? Sealed or unsealed. Write down the word sealed or unsealed. So sealed means is in the body, brachytherapy. Unsealed means is not in the body. Are we clear? So we got to know the wording. So, and it comes in exam. Brachytherapy is, you're giving radiation. Remember, brachytherapy means you're giving radiation continuously to your patient, either by unsealed or sealed. So what is brachytherapy? Is sealed and unsealed. Let's go in our box. It says sealed source. I wanted you guys to add the word brachytherapy. Brachytherapy is for radiation. Sealed means it's in the body. So lead container and long-handled forceps in the room. So what are you doing? You keep the forceps in the room and save all dressing, linen, and sources until your patient is removed. Urine and feces are not radioactive here. Are we clear? In sealed radiation, they are not causing any contamination, is causing exposure. Don't stand too close and line with the source. How far do you stand? How far do you stand? 6 feet. Write down there 6 feet. And patient should be on bed rest. And I want you to write down what kind of a isolation. Strict isolation, other word is reverse isolation. Are we clear? What is the meaning strict? You're protecting from your patient to the others, so you're putting closing. Are you going to close the door? I want you to write down the door is closed. Are we clear? And who are we saying the word? A strict isolation, close the door, patient is in a bed rest, you have a sign on the door, patient has radiation, any visitors, anyone is coming inside, they should stay away from the patient. The distance is 6 feet. Are we clear? Why do you have a bed rest? So the radium doesn't get out of the body. So you are preventing that. And so those are important. And how long do you stay in the room? Is 30 minutes in 8 hours. Do you rotate the nurse? Yes. And don't give one nurse the same patients. No pregnant person. Make sure you add there no pregnant and no children. Same thing with the visitors. If one visitor is staying all day, they shouldn't be spending more than what? 30 minutes. So everyone, strict isolation, radiation. When they are giving the word sealed, it's not going in the urine and the feces. Are we clear? So you got to protect. If the radium comes off from the body, then what do you use? Use the forceps to pick up. Time and distance is important. Sign on the room. Nurse should wear a special gown and they have an apron and limit the visitors spending time. Rotate the staff is good. Self-care, what they can do. Let the patient do whatever they can do laying. If you have to give only the communication, you can stand on the door. You don't have to come closer. So remember, rotating your staff is good. 30 minutes time is important. 6 feet distance is here. Now, cancer implanted is called unsealed. So everyone is okay. What is brachytherapy? Radiation. How do you give radiation? Sealed and unsealed. Now when we are saying unsealed, unsealed means you're giving, write down there, IV, route, and oral. That means radiation is given through the oral and IV. And it comes out from the body fluid is contaminated. Are we clear? So if they give you a question, patient has unsealed, then what are you protecting? The body fluid. When you are sealed, then you have distance from your patient. Danger, how long you should take care of the body fluid is 24 to 96 hours. So some books has 24 to 48, some you have 24 to 96. So whatever you guys get it is at least 24 to 48 hours. You should is taking care of the body fluid. Everyone is okay about a little bit about the cancer. All your patients with cancer, we will be talking about the drugs later in these pages, but I will go mostly on radiation, how to prevent cancer. You must know all your breast examination, testicular exam, pap smear should be done. How do you prevent cancer? Going regular checkup. So they can do the regular. So you teach people to do the breast exam, mammogram, testicular cancer, very common, cervical cancer, very common, ovarian cancer, very common. Are we clear? So those are different kinds of cancer questions. So when you are practicing your question, any question come, lab test come, make sure you start looking on there. Now the next thing is leukemia. What is leukemia? Word is bone marrow. And what happened in bone marrow destruction, you have red blood cell, white blood cell, and the platelet. So there may be a question for isolation, there may be a question for what? Bleeding, there may be a question for anemia. Are we clear? I want only you recognize the word. When you see the word leukemia, they're talking about the bone marrow. So write down the word bone marrow and write down the red blood cell, white blood cell, and the platelet. So you have anemia, fatigue, weakness, and pallor because of your bleeding. Monitor for bleeding, petechia, and underline the word thrombocytopenia. And infection. What isolation are you going to put if your patient has leukemia? And it's called neutropenia. Next word. What is a neutropenia? White blood count is low. So neutropenic precaution. That means they're talking about the white blood cell is low. Now I want you guys, I'm going to do in this week, I will continue at the in between your isolation. I will review that, and there are a lot of wording on the pages I gave you. If you have those, is the wording for white blood count. Are we clear? And they use those wording. They're not giving white blood count. Neutropenic. Patient has neutropenia. What isolation are you going to put them? Reverse isolation. If their white blood count is lower than the normal, what isolation are you going to put them? Again, reverse isolation. Thrombocytopenia, you got to know the platelet count. So if platelet count is low, patient has to go in monitoring for the bleeding. If the white blood count they're addressing, you got to remember is, and what do you avoid when your patient is in isolation? No fresh fruits, flowers, and plants, avoid them. Even for toothbrushes, everything contamination, the resistance is low. You're passing infection. Cleaning the toothbrush is important. Not sharing, you can get infection. Oral hygiene because of the bleeding problem. Diet, what diet is good? Is high vitamin diet, avoid salad, any fresh fruits. Canned fruits are okay, pay attention here. And also pepper. Pepper is a fresh, are we clear? And so maybe a green pepper, raw fruits, and reuse cups. Don't change litter box, digging in the garden, because why? The risk for infection. Are we clear? See how your questions are, anything they can cause infection. And what do they have here in leukemia is the bone marrow. And how do they treat them? By giving bone marrow transplant. Are we clear? Bone marrow transplant they will give them, and that is leukemia. So all we know is leukemia, we know. We already talked about the blood disorders. And the next I will move on, inter-cranial tumor. Inter-cranial means is in the brain. Are we clear? Anything is in the brain is what do you monitor if you have a tumor is your motor. What is motor? Your brain is controlling your muscle. Now we know level of consciousness. What happened in coma? Somebody goes, your muscles are weak. And visual and hearing. And also paresthesia and seizure, personality changes, changes in level of consciousness. I want you to write down ICP. Your brain controls your muscle, all your body. Anything you see with the brain, if they have a tumor, can be affected. Pre-op care, what do you do if your patient has a tumor in the brain? Your answers are going to be ICP, and motor, coma word, they may go in coma, and they're going for, underline the word, craniotomy. So what surgery they will do when they have a brain tumor is again craniotomy. Any bleeding in the brain, tumor is in the brain, craniotomy. And what do you do for craniotomy? Patients are, very important, shave the head. You may have to shave the head. And the surgery would be craniotomy. Post-op care. The first thing post-op care, you after craniotomy, airway, and elevate the head only. Supratentorial, you will raise 30 to 45. Rest, you will keep them flat. Remember, I did yesterday, and I said craniotomy, infratentorial, you keep them flat. Supratentorial, you keep them as they come from what position? Semifowlers. And also neurological assessment, glioblastoma, we already talked about it. And also, when they come back after craniotomy, one more thing I will remind you, they may have bruising around the eyes, orbital bruising, and you can apply the cold compress or the cold thing, and because they may be showing some bloodshed, and they may have is preorbital edema and swelling. Are we clear? And bruising. So patient asks you, why do I have bruising? It happened because of the craniotomy. So it can lead to some bruising afterwards. So shaving is important for craniotomy. And what position do you put your patient in craniotomy? Flat, infratentorial. Only you will raise the head of the bed is semifowlers right from the beginning in supratentorial. And we did talk about yesterday ICP, and I hope you guys start reviewing it and make sure what are the sign and symptom of ICP. Are we clear? But remember, brain, if they're saying check the motor, check the glioblastoma scale, yeah, that's a neurological assessment. Now the next box, you guys have positioning. I gave you the paper, and I'm going to review the pages, and with the pages I'll review and show you. You must know when they give you the picture, because they're giving the pictures. Are we clear? And when they throw the pictures and they say, patient come back on this, or patient is going for this test, what position do you put it? Are we clear? So we have it here, supine position is in the back. avoid hip flexion. Dorsal recumbent, you knee flexed, and write down Foley catheter. When you're putting Foley, you put dorsal recumbent only in female. In male, you keep the legs straight, you don't bend them. But what are you doing in dorsal recumbent? They're on the back, but you are bending the knee. Are we clear? That's a dorsal recumbent position. And number 3 is your prone position. When do you put prone position? Underline the word amputation. Underline amputation and add there, maybe cleft palate baby. If your baby come back after cleft palate surgery, because palate is inside the mouth and they can aspirate. Tonsillectomy, maybe a prone position they're giving you. And turn the head to the side, but you lay them on the stomach, turn the head to the side. And you may use it, but definitely you are using in what position? Prone position is for amputation. What are you avoiding?
Flexion.
Flexion. What are we avoiding? Flexion. So make sure, add there. Lateral position, if your patient is having seizure, what side do you turn them? On the side. And what are you preventing? Oral secretion. Sideline, side lateral, and also you turn the head to the side to prevent from aspiration. Knee chest, your patient is laying on the chest and knee chest. The knees are bending. That's a knee chest position. They're going like this. And what are you assessing is the rectal area. Sims position, write down left Sims. Sims means left Sims only we use. You turn them on the left side, and remember the right leg is flexed like this. And when do we use left Sims? For enema, suppository. And when you're giving enema, suppository, any cream you're giving, you can put them on Sims position. Then Fowler's position. For lung, whenever you have breathing problem, you go more on Fowler's position. You're expanding the lungs. Then you're going Fowler's. Now what is Fowler's are? High Fowler's is 60 to 90. Fowler's is 45 to 60. Semi-Fowler's start from 15 to 30, that is low Fowler's. Little bit semi-Fowler's is more your 30 to 45 degree. So low Fowler's, semi-Fowler's, and you're going in 30 to 45 degree. Then you will go on modified Trendelenburg position, is on elevating their feet, and also it's called modified in shock. So remember, what are you elevating? The feet of the patient. We are doing the package you have on page number 26. So pages are in the bottom, so look on page 26, okay? So we are talking about, right on the top, it says positioning. Very important for your Nclex, that you must know, and they're giving all your tests, and they're throwing the picture, and they're asking you what picture you're going to use it for which patient. Are we clear? So modified is, when do we use it modified? Shock patients. When your patient is going in a shock, dehydration, shock, you raise the head. And elevation of extremity. Increasing the extremity, elevation of extremity, like a patient come back after cast. What do? Elevate all your extremity. Why? After you have mastectomy, what do you do after mastectomy? Raise the arm above the level of the heart. And why? To reduce what? Edema. Are we clear? So why do you elevate? All your surgery patient you are elevating. All your patient, when they come back after mastectomy, you raise the arm. If they put the cast, what do? Elevate. Why? To prevent edema. Are we clear? So what are you improving here? Circulation. Lithotomy position for vaginal exam, pap smear, having a baby, and lithotomy you go like this, right? That's a lithotomy, laying on the examination table, and the female's legs are resting on higher. Are we clear? That's a lithotomy position. So these are some of your position. I gave you the pages, and I'm going to give you, and I'm going to show you, make sure you guys recognize what is this position and where do we use. So whenever you're coming back, amputation, you should know. Mastectomy patient, you should know. CAS patient, what do you do? What position? Anima, what position do you go for anima? Left lateral, everyone should know anima, rectal suppository. So those are very important to know our positioning. I'll finish this page before we take a break. Now I'm going on your ambulation, your gaits. You're using a crutches and you're using a cane and a walker that goes in your skeletal system. 4-point gait. What is a 4-point? You're moving 4 things, 4-point gait. And where are we using 4-point gait is weight bearing both legs. That means you can put the weight on both legs. Are we clear? They're non-weight bearing. When your question comes, non-weight bearing, that means you cannot put the weight. Non-weight bearing, weight bearing means you can put the weight. Are we clear? So you can put the weight, there's no restriction, and you're using 4 points. So what are you moving first here is right crutches. So you move one crutch, and what are you moving opposite? The left leg. Are we clear? So always you go opposite. So what do you move here? So remember, you're moving first right crutch. Any crutch you're moving, and then you're moving leg. Now what do you move the other side? The left crutches, and now you're moving the right leg. 4-point means everyone goes separately. They're not moving together. Everyone is okay, and you can put the weight on their leg. 2-point gait. What is 2-point? They're only moving twice. And how? So if you're moving right crutches, you move the left leg. Same time, not separately. Everyone is okay. And then if you're moving left crutch, then you're moving is what? The right leg. Are we clear? So remember, this is the way your 2-point. And it says both leg, bearing weight on both leg. You can put. Now 3-point gait before one leg and weaker leg and both crutches. And this is the one, write down 3-point gait, non-weight bearing. What is non-weight bearing? After hip surgery. If your patient come back and they cannot put the weight, they're going to go on 3-point gait. Wearing one leg, and now what do 3-point means? I want you to remember, write down, you move both crutches, the third line, both crutches with weak leg. So whatever the leg you're moving should go with both crutches, the weak leg. And then you leave the weight on the stronger leg, and then you're moving the stronger leg. Are we clear? And where do we use 3-point gait is non-weight bearing. Then you have swing through. What is swing through? Partial weight bearing. You can put some weight. And both leg and crutches and 1 or 2 legs, they move together. So both crutches move and both legs swing. Remember that way. Swing through means you're moving both crutches and you're swinging through between the crutches. And that also comes in the exam. Everyone, however you guys know, you got to know the crutches. Okay. Now, when you're using a crutches, then you go stairs. When you're going on a crutches with stair, always remember, you move the good leg when you're going up. And also good leg first, and the crutches together, and then bed leg. Are we clear? So what leg are you moving with both crutches? The good leg, and then you move the bed leg. When you're coming down, crutches with bed leg, and then the good leg. So remember, going up with the good, coming down with the bed leg. So this is very important that we got to know. And when you're going stairs and swing through, 4-point gait, there is nothing without you guys know for your Nclex. Make sure you understand good, and they might say the word weight bearing, non-weight bearing. How do you teach your patient to go on this? Now walker, flexion of walker is 20 to 30 degree, and both hand on the grip. So flexion of walker and flexion of your crutches are same, 20 to 30. Flexion means the elbow flexion. So remember, walker and your crutches are same flexion. So if they ask you how do you flex the arm, 20 to 30. Lift walker forward and move so when you're moving the walker, you move the walker with, underline the word bed leg. Are we clear? And also stand behind and holding onto gait belt. So if you're a nurse, you should use a gait belt in the back of your patient by holding and moving. Cane, make sure write down the cane. How do you move cane? Where is the cane? So add on the side. The cane should be always on good side. Are we clear? So if you have a weak side, you put the cane on what side is the good side. Move the cane with what? Weak leg, just like walker. But which side do you hold the cane on? If you have a bad leg, right hip fracture, you keep the cane on the good side, on the left side. Now you move the cane and you move the weak leg together. Are we clear? Same in walker. There's no difference. Read your question. You move walker and weak leg together. Cane, you move weak leg and cane together. Are we okay? And cane flexion, I want you to add there 15 to 30 degree. So your arm should be bended 15 to 30 degree. Very important that we understand ambulation. We already talked about positioning for Nclex. You cannot move without knowing these things. These are nursing. Next is myelogram. X-ray visualize the spinal canal by injecting the radio-opaque dye. And hydration is important, but only thing you remember is if the water-soluble dye, you elevate an oil-soluble flat. That's important. So you should know the positioning after patient returns from myelogram. Next page, we'll move on. On page 27, enema may be given, avoid sneezing. They said bed rest and encourage fluid. Laminectomy goes in your spinal cord. A laminectomy goes in neuro. So patient returns from laminectomy. They have removed the lamina and exposed the affected area. So what would you do post-op care, pre-op care? Heat you can apply for pain. Fowler's position, isometric exercise for abdominal muscle, you teach them, and maybe NSAIDs for pain medication, analgesic. What is NSAID does? Reduce the inflammation, not only for pain, for inflammation, and TENS unit for pain, you can use it. After the patient, so this is laminectomy question, and that goes in your neuro, and patient come back after laminectomy, always think about, they're talking about the back and the neuro system. And what do you do is circulation. How do you turn them? Log rolling. All your patient with spinal cord injury and laminectomy, you roll them in one piece. Are we clear? That is a log rolling. You don't want any back to get hurt. And also, calf exercise assist with ambulation. Underline the word keeping the back straight. All your spinal cord, laminectomy. Now avoid twisting anything in there. Muscle relaxant, NSAIDs you can give them, and analgesic you can give them. Avoid prone position and heavy lifting, and avoid sitting for a long time. Those are important. Don't let them go on the back. Don't let them sit. Avoid the back. And remember, all your exercise are good. Now, the next thing is dysplasia of hip assessment. After this, we'll take a break. So, a dysplasia of hip is in the peds. So, write down on the peds question. It's in the babies who are born with dislocation of the hip. Are we clear? So babies are born and they're born with hip dislocation. What would you see when the babies are born with dysplasia of hip, sign and symptom? Number one, uneven gluteal folds. Their fold of the buttocks are uneven. They're not same. So if you have hip problem, your buttocks are not going to be. So if you take a baby and you look at, the buttocks are going to be up and down. Are we clear? So uneven gluteal, and we say gluteal folds are the buttocks fold right here. That's a gluteal muscle. Limited abduction of hip. What is abduction? Remember, ad means adduction. Abduction means away. Limited, they cannot open their legs. So what are they having? Adduction. Are we clear? So adduction, orthogonally sign. What is orthogonally sign? If you place an orthogonally sign is done by the physician. There was a question somebody was doing, and they said, who will do orthogonally sign? There was a question, is done by the physician. And what are they doing? They place the baby on the back, and the legs are flexed and clicking around, underline the word click sound with abduction. So what the doctor is trying to do, they take the baby's leg and they are abducting. What is abduction? Away. And so when they do away the leg and they hear the click sound. So what is it called? Alternally sound. Are we clear? So what are the three things are the sign of baby's hip dysplasia? Is number one, is uneven gluteal fold. Adduction word. Number three, remember, is alternally sign. That means you hear the click sound when abducted. Who does that? The physician. Next is shortening of the leg. Always remember, when there is a hip problem, the leg is going to be shorter. How do they treat the babies? Comes in exam. And these are, everyone should know, newborn baby, 6 months, they use Pavlik harness. For 3 to 6 months, it's like a sling. If you go home and look in your Saunders book, in the ped section, they have Pavlik harness. It's like a sling goes between the leg and they're keeping the hip together. Are we clear? So, and what do we use it? So anywhere they give you Pavlik harness is used for the babies for hip dislocation. You should know. Next is how long they can leave this. For 3 to 6 months, they will leave it on. And also, so remember, leave it on 24 hours. You do not remove. You can change the diaper, but you do not remove Pavlik harness. Are we clear? So they ask in the exam, does the child has to wear continuously? Yes. And check the skin assessment, but do not remove. 6 to 18 months. After that, if it didn't help, they may use bilateral. What is bilateral? Is both sides. Is Bryan traction, and hip Spica Cast. And if they become older and it didn't help, then what do they do it? Now we all know what is hip Spica Cast is. And I'm going to give you the pages with the pictures. It goes right from here on the stomach, and they apply up till the hip and goes in the leg, and they have a little bar. So always remember, hip spica go cover the abdomen. So what do you assess? Abdominal pain. What do you assess? Nausea and vomiting. What do you assess here? Constipation. So any hip spica cast is applied right from the abdomen, covering the hip and covering the leg. Are we clear? So that's a hip spica. If it didn't help, in open reduction. So dysplasia of hip goes in your PEDS question. Everyone should know alternally sign. Everyone should know Pavlik harness, that is put it on the babies for using them continuously for 6 months, from newborn to 6 months. If that didn't help, then they will move on to Bryan traction or hip spica. If that didn't happen and they become older, they may have open reduction, mean they have to do the surgery. Are we clear? And they're going to do it, but they try to fix it is without the surgery. Let's take a break for 10 minutes and then we will continue the next. Okay.